Good day, everyone. Today, I will be speaking about mental health services in Japanese high schools. My name is Dr. Sachi Tamakawa from the Faculty of Education at Shinshu University. In this presentation, I will discuss the mental health challenges faced by high school students in Japan, the framework of support within and outside of schools, and the future challenges of mental health services. In 2024, the Ministry of Health, Labor and Welfare MHLW reported a record high of 527 student suicides, with a significant increase among female students. Breakdown by school level. Elementary, 15 students. Junior high, 163 students. High school, 349 students. The graph shows a rising trend in student suicides, with high school students being the most affected. This highlights the urgent need for enhanced mental health support in schools. The percentage of students with possible developmental disabilities in regular classes has risen to 8.8%, a 2.3% increase from 2012. This increase is seen across all grades, as shown in the graph. Key concerns: communication difficulties, poor school performance, higher truancy risk, social and academic struggles, mental health challenges, need for early intervention. This trend highlights the urgent need for stronger educational and mental health support in schools. Mental health services in schools are integrated into 1. Health education, lessons, activities, and individual guidance. 2. Health management, checkups, counseling, and environment safety. 3. Organizational activities, collaboration with teachers, parents, and local organizations. This framework ensures comprehensive mental health support through education, management, and cooperation. Mental health services in schools are part of the school health system, which consists of 1. Health education. Health learning subjects covering well-being. Health guidance, individual mental health support. 2. Health management. Supervision of physical and mental health checkups, counseling. Supervision of environment, safe school setting. Supervision of daily living, monitoring student well-being. 3. Organizational health activities. Collaboration between teachers, staff, and external specialists. This diagram shows how education, management, and collaboration form a comprehensive support system for student mental health. Mental health services in Japanese schools include 3 key components. Health guidance is provided by classroom teachers and yogo teachers to support students in daily life. Supervision of physical and mental health involves regular health surveys, counseling, and stakeholder meetings. Since 2022, preventive mental health education has been introduced, covering social skills, life skills, and mental health management, including anger control and early intervention. These efforts aim to promote students' overall well-being. Now, let's take a look at the annual routine activities related to mental health services in schools. Each academic year follows a structured cycle to ensure students' mental health needs are regularly assessed and supported. In March, schools prepare for the new intake of students. April marks the beginning of the fiscal year and first semester, with students required to submit individual health questionnaires. In May, the annual health checkup takes place, along with face-to-face interviews for new students. Additionally, periodical meetings among teachers are conducted to discuss students' well-being. During August summer vacation, yogo teachers participate in in-service training to enhance their skills in supporting students' mental health. At the start of the second semester in September, another teacher meeting is held to review student concerns. The third semester begins in January, accompanied by another teacher meeting to ensure continuous monitoring and intervention. These structured routine activities highlight the proactive approach of schools in maintaining students' mental health and well-being throughout the year. Mental health cases in schools are identified through 1. Reports from teachers, classroom and subject teachers report concerns. 2. Consultation requests, children and parents can request support. 3. Reports from classmates, peers may notice and report issues. 4. Health surveys, conducted with students and guardians to assess well-being. These methods help detect mental health concerns early and ensure timely support. In Japanese schools, multiple stakeholders work together to support students' health. Inside the school, under the principal's direction, yogo teachers, school nurses manage health checkups, counseling, first aid, and the school infirmary. The health supervisor plans and oversees school health programs for the year, ensuring coordination among staff. Physical education teachers handle health education in secondary schools, while homeroom teachers take charge at the elementary level. Nutrition teachers manage school meals and food hygiene. Various school leaders, including the academic affairs director, discipline supervisor, and physical education supervisor, also contribute to health education. Outside the school, school doctors, dentists, and pharmacists, known as the 3 school medical specialists, play key roles in health management. School doctors conduct regular health checkups, first aid, and vaccinations, while school dentists provide dental examinations. School pharmacists oversee environmental hygiene and medication management. For students facing mental health, financial, or family issues, school counselors and school social workers offer support. During infectious disease outbreaks, schools collaborate with public health centers and school doctors to implement health measures. The COVID-19 pandemic highlighted the importance of school counselors and social workers in addressing students' mental health, financial struggles, and cases of child abuse. Many schools also operate school health committees to strengthen health policies and infection control measures. Through this coordinated, multidisciplinary approach, Japanese schools ensure students' physical and mental well-being. In Japanese schools, multiple professionals contribute to mental health services. Yogo teachers, school health educators, are permanent staff members with additional training. They coordinate mental health initiatives among all stakeholders. Special needs coordinators work closely with teachers and parents, creating individualized education plans for students with learning disabilities like ADHD and LD. Classroom teachers play a crucial role in student well-being by identifying concerns and coordinating with guardians. School health team teachers regularly share students' health information in periodical meetings, ensuring ongoing support. This structured system allows for a multidisciplinary approach, ensuring that students receive continuous mental health support. In addition to school-based support, external professionals provide mental health services. School counselors work part-time, typically once a week. With a background in clinical psychology, they offer counseling to students, parents, and teachers. School social workers provide assistance when necessary. With expertise in social welfare, they help students by addressing family and environmental factors, connecting them with external support networks. These professionals collaborate with schools to ensure a comprehensive approach to students' mental well-being. Several external professionals provide mental health services for schools. 1. School doctors. Work part-time and provide medical counseling and health guidance. Act as a link between schools and local medical institutions. Assist in the early detection of child abuse through checkups. 2. Child Guidance Center staff. Includes child welfare staff, psychologists, and shelter staff. Offer home visits, interviews, and stakeholder meetings. Conduct psychological assessments and therapy for children and families. These specialists strengthen school-based mental health services by offering medical, psychological, and welfare support in collaboration with schools. The Japanese education system provides key guidelines and handbooks to support mental health services in schools. 1. Teacher's Manual for Student Guidance 2022. A comprehensive guide for teachers to support students' mental and behavioral development. 2. Enhancement of Educational Counseling 2022. Focuses on guidance for guardians to improve parental support in mental health. 3. Guide to Responding to Child Abuse 2007. Aimed at Yogo teachers, school nurses to help detect and manage child abuse cases. These resources strengthen school-based mental health education and support teachers and school staff in addressing student needs. The Teacher's Manual for Student Guidance provides a structured framework for supporting students' well-being. Chapter 1 covers the fundamentals, including definitions, methods, and teamwork-based responses. Chapter 2 focuses on integrating student guidance into the curriculum. Chapter 3 introduces a team-based approach to student guidance. Chapter 4 addresses thematic issues such as bullying, truancy, child abuse, suicide, mental health concerns, and economic difficulties. This manual ensures that teachers are equipped to handle diverse challenges in student guidance. The structure of student guidance is designed to support students through 4 layers, 3 categories, and 2 guiding axes. 2 axes. Reactive and continuous support for immediate intervention. Proactive and preventive support to create a supportive environment. 3 categories. Developmental support for all students. Preventive guidance to address potential issues early. Intervention for difficult issues such as bullying and truancy. 4 layers. First layer, universal developmental support. Second layer, prevention of latent issues. Third layer, early detection and targeted intervention. Fourth layer, specialized support for severe cases. This system ensures a comprehensive, multi-tiered approach to student well-being. The student guidance system is structured with 2 axes, 3 categories, and 4 layers to ensure a comprehensive approach to student support. 2 axes time perspective. Reactive and continuous support, immediate response to emerging issues and ongoing assistance. Proactive and preventive support, taking preventive measures and fostering a supportive environment. 3 categories type of issues. Developmental support, general support for students' growth and well-being. Preventive guidance, addressing potential issues before they arise. Intervention for difficult issues, providing intensive support for severe problems like bullying and truancy. 4 layers intervention levels. First layer, developmental support for all students. Second layer, prevention of latent issues through education. Third layer, early detection and targeted intervention. Fourth layer, intensive support for serious cases with external collaboration. This system integrates early detection, preventive action, and intervention to promote a safe and supportive learning environment. Pre-service teacher training for mental health support (MHS) in Japanese schools begins in grades 1 to 2 of university education. Trainers, university professors, retired school principals, and psychology specialists. Curriculum covers educational counseling, student guidance, developmental psychology, and the basics of special needs and support education. Since 2019, support education has become a compulsory subject. Method, delivered through lectures and practical training, with each lesson lasting 16 hours. This training ensures that future teachers acquire the necessary skills to support students' mental health effectively. In-service training for mental health support (MHS) in Japanese schools is conducted during summer vacation or the school semester. Location, training centers at the prefectural level or online. Trainers, university faculty and medical professionals, including clinical psychologists and counselors. Trainees, vice principals, general teachers, and yogo teachers. Purpose, conducted by government mandate or at the teacher's request. Curriculum, covers special needs education ADHD, LD, etc., mental health issues depression, suicide, and child abuse. Method, delivered through lectures and practical training by experts. This training enhances teachers' ability to address students' mental health challenges effectively. Mental health support (MHS) in Japanese schools has several key characteristics. 1. Stakeholder cooperation. Collaboration occurs inside and outside the school. 2. Human resource development. Clear role classification, revised in 2022, ensures yogo teachers act as coordinators. 3. Specialized training. Educational and research specialists receive training. 4. Practical guidelines for educators. Schools promote MHS awareness as a foundation for educational activities. 5. Early detection and prevention. Schools conduct regular monitoring to identify issues early and implement preventive education. This structured approach strengthens the mental health system within schools. Mental health support (MHS) in Japanese schools faces several challenges. 1. Stigma and low utilization of counseling. Students hesitate to seek help due to fear of being seen as weak. 2. Shortage of school counselors. Counselors work part-time, making continuous support difficult. 3. Heavy teacher workload. Teachers have limited time for students' mental health due to excessive duties. 4. Bullying and school absenteeism. Cyberbullying and absenteeism contribute to increasing mental health issues. 5. Lack of parental cooperation. Parents hesitate to address children's mental health due to complex home situations. 6. Inadequate response to mental disorders. Schools lack structured systems for early detection and intervention. Addressing these challenges requires systematic policies, increased staffing, and stronger collaboration between schools, families, and communities.